Hi, this is Travis with another video for you guys. Again, for those of you that don't know me, I'm a doctor of physical therapy. I've also been a personal trainer for around 15 years. And so today the topic's going to be back pain. I've definitely been somebody who's had some back pain myself. And so I know sometimes it can be difficult, where do I start, where do I go from here? Hopefully what I'm going to be able to do is just kind of simplify things a little bit and just kind of break down some really simple ways to reintroduce some movement that doesn't put a lot of load on your back. And so certainly it's going to be tough to speak to all different types of back pain. That's not necessarily what I'm trying to do. Just give you guys a few ideas on how you can kind of gently reintroduce some movement for those of you who've had some pain in the past. So no equipment for this video, just some pretty simple stuff you can do right in your living room. If you can get down on a yoga mat or someplace on the floor or a firm surface will do the trick, and we'll go ahead and get started. Okay, so the first thing I want to talk about is something I call hip swiveling. And so typically the way people do this, you'll see somebody just kind of rotate their hips side to side. Sometimes they'll say put your knees together and do it, and I see people do this quite a bit, okay? And that's okay if you can get away with it. Sometimes though, depending on how much pain you have, widen their feet apart a little bit, because the wider your feet are, the less movement you're going to tend to get, less rotation at your low back. And so for somebody whose back is pretty angry and maybe they can't tolerate a lot of rotation, sometimes I'll just tell them to just really gently rock. Maybe sometimes it might even be just an inch or two. So it doesn't even have to be a very big movement in the beginning. All you're looking for is a starting point that allows you to feel like you can get some movement without a lot of pain. Obviously, if the pain is escalating as you're doing these things, you don't want to force it. And so sometimes you might have to start here, maybe with your feet even wider, and just do some real gentle rocking, kind of side to side, or swiveling as I tend to call it. And then hopefully with time, what you may start to notice is that you can gradually, and this may not happen in the moment, this might take even, sometimes a couple of days or longer to kind of get to a point where you can start to go all the way down, okay? But, in the beginning, you may have to start here, and typically I don't tell people to count. You can if you want, but just go for time, and as long as your body's relaxing into it and things are feeling pretty good, you can certainly keep on going for a little while. If you don't really have a read on things yet, you're not sure how you're going to feel afterwards, I would maybe just stick to about a minute or so, okay? Once you've done this a few times though, you certainly can increase the time a little bit, increase the, what we call the amplitude, and as long as you're feeling good, you can kind of relax into it. Again, you're not braced in your core here, you're just kind of relaxing into this. This is just a gentle movement. You're not trying to tense up those muscles. Just kind of keep things relaxed and just see if you can kind of loosely go from side to side, okay? And then to start to put a little bit more rotation in the low back, you can move those feet together like I just did now. And then from there, see if you can start to tolerate that, okay? And so again, it may take a little while to get up to a point where you can do this, going side to side like so. But as long as you're moving in that direction, then hopefully eventually you can get to a point where you might be able to do that. I've seen people do this before where their legs are off the floor. That puts a tremendous amount of demand on that low back. So just keep your feet nice and heavy on the mat. Don't do one of these ones where you're up in the air yet. Just kind of nice and soft here, feet on the ground. And that's the one I call hip swiveling. Okay, so the next one in the lineup is going to be one I call heel tapping. Now bracing on this one is optional. Ideally, the way you want to tend to brace is more almost like you're pushing your stomach out. So almost like a fourth grader was going to give you a little uppercut in the stomach. You're just a little tense through the middle. And if you can do that, then great. If that causes too much pain or anything down your leg, don't worry about that. But the idea really more than bracing is you just don't want a lot of movement through here. Just kind of keep this as still as you can. And then from there, you're just going to gently bring one knee up to about where your belt line is. So imagine if where my belt is here, there's kind of a plane that's moving out of there. So I would just move my knee up to about where that plane is, okay? And just trying to minimize the movements in my torso. So I'm not really rotating a lot through here. You don't see a lot of wiggling. So as the leg comes up, I'm not really moving to the side. And so just nice and gentle here. And this can be a pretty gentle starting point because again, there's not really a lot of movement being produced here. It's just what we call stabilization. And so, sometimes this can be a pretty easy place to start, okay? Now, if that is a little bit too much for somebody, you certainly could maybe try doing it with your arms, okay? Or you maybe bring one arm up at a time, something like this, okay? Because the weight of the arm is definitely less than the leg can sometimes be pretty heavy depending on how large your thighs are. So even there sometimes can be a difficult starting point for some people. Once you've kind of gotten that underway though, and you can do this without too much discomfort, it's getting pretty easy, all you have to do is move your feet out a little farther to make it harder, okay?
So if I do this with my feet out, now that demand is a little higher, these muscles are going to have to work a little harder to not move with my leg, okay? And so obviously leg straight. Now, if you've had some back pain in the past, I probably wouldn't recommend doing this with your legs straight just yet. You know, if you can go out to where your legs are, you know, fairly straight like mine, that's probably about as far as you need to go. And that's pretty good. And, you know, again, if you can do, you know, maybe a good 10, 15 on each side, that's probably a good number to shoot for, okay? Now, if you're really starting to do better and you're getting pretty strong and that's getting easier for you, you could start out with your legs a little bit in the air, kind of what I call a chair position here, because it's almost like I'm sitting in an invisible chair. And then from there, just gonna lower one leg down for a light little heel tap from here, okay? Again, your pelvis is gonna wanna tend to follow your legs, so as your feet come down, your pelvis is gonna wanna kind of drop down with it. So just kind of think about a laser pointer shooting out of your belly button, and you kind of keep that red dot, you know, right where it is. So not really a lot of movement happening in this lower abdominal area. Just pretty much the leg moving down one at a time, okay? And that's the one I call heel tapping. Now, same kind of thing there. If you're getting to a point where you're pretty strong, you know, rather than keeping your leg kind of bent at 90 like I am now, you could do this one with your legs a little straighter as well, okay? And that's gonna be a little bit more work for some of those lower abdominal muscles. So, again, if you're at that point, my guess is your back shouldn't be hurting you too badly, and you're getting pretty strong now. But again, just to kind of back that up, you know, if you have some acute pain, I probably wouldn't go for all that just yet. I would just start, you know, pretty light, just to kind of get some gentle movement happening here. And once that starts feeling pretty good, then you can start to do those harder progressions. Okay, so next one I want to talk about is a little bit of pelvic rocking here. So we just talked about swiveling a minute ago. Now we can go kind of the opposite direction, where I'm going more up and down. So just to give a better visual in this rocking business, I'm gonna just put something on my waist. You can kind of imagine this is a belt or a belt buckle. And essentially all I'm doing is I'm just pointing it up toward my chin and then down toward my feet, okay? So in real time, it ends up looking a little bit like kind of a rocking movement. And so this is just, again, a little bit of gentle movement to start to get back that flexion, that ability to bend. Because many times, as some of you will probably already notice, if you have an intense episode of back pain, bending is definitely not something that happens very well, and definitely can make your symptoms worse sometimes. Luckily, there's not a lot of gravity really compressing my spine right now because I'm laying down. And so again, it's just a pretty easy way to start getting into that again. And you know, again, you may not be able to go very far in the beginning. It may just be a small movement. And then eventually in time, you can try to increase, you know, sort of the amplitude, as we call it, of that movement. And as things are loosening up and you're feeling pretty good, then you can eventually start to get into a little bit of a bridge with that. Now, once you're starting to a bridge, you don't have to rock anymore. From there, you just want to keep your pelvis locked in where it is and lift your hips up a bit, okay? And again, in the beginning, it may not even be a very high lift. You might want to just start with a real small one. Again, we're just looking for that comfortable window you can do that just feels like you're working some muscle. It doesn't feel like you're really putting a high demand in your back. So if you want to start real small like this, that's totally fine. And then gradually, with some time and practice, you can start to go a little bit higher, okay? Until hopefully at some point, you can go to where you're almost about straight. Now, you don't have to really arch your back on this one. You know, just trying to keep what we call more of a neutral spine. So pretty much, you know, a relatively straight line from your hips down to your knee. So you don't necessarily have to be super arched on this one, okay? And once you can do that comfortably, you know, then you want to start to see if you can go, just again, a brief pause at the top, down for a little touch, up and down. And hopefully eventually you can get up to a point where you can do a couple rounds of about 20 or so of that. And that's just a real nice way to start strengthening up the glutes that doesn't put too much of a demand on the low back. Here's another good movement some of you will be familiar with who've seen a few of my other videos. This is just the one they tend to call the cat camel. There's really not a lot I have to say about it other than the fact that I like to keep, again, kind of a wide base of support. So a lot of people tend to put their knees together on this one. I tend to go a little bit wider when I get on all fours and then my tabletop. And from there, I'm just going to pick up my middle of my back and then go down towards the floor. Now, again, with your head, now for some people looking up on this one might also be kind of bothersome. So I tend to follow my body a little bit when I'm going up. But then on the way down, I just pretty much come to neutral. Okay, maybe a little higher, but not much. And so I go up and down. Now for some people, going really far in each direction might be a little bit bothersome. So again, it could just be, a fairly small movement. It doesn't necessarily have to be going up and down really high. Sometimes I think we want that feedback that we're doing something and we push ourselves a little bit too far. So even just doing kind of a small movement like this is a fine starting point. And then as you start to get comfortable and you feel like things are going well, then you can certainly try to increase the distance that your back is moving, as long as nothing's bothering you there, okay? And again, this is just a pretty gentle way to start introducing a little bit of flexion and extension. So not really a lot of load going through the spine in this position, so it's pretty gentle, and for many people it's pretty well tolerated, which is why it's probably such a popular exercise for people who've had back pain. Okay, so the last one should be pretty familiar to you also for those of you who've seen some of my other videos. This is going to be the bird dog, and I'm going to break it down into parts for those of you who have a little more pain. So the simplest way to start into a bird dog would be to just move your arms only. Just lock that position in, and then just lift one arm up at a time, okay? So this would be the easiest place to start. Now, if this is going pretty well and you start to feel like this is getting pretty easy for you, all you have to do to make it harder is just walk your hands forward a little bit, move your chest back over your hands, and then try from there. And again, this is going to be a bit more demand on those core muscles. You certainly can keep going there, because again, the more distance between your knees and your hands, the harder it's going to be. And so once you're in a place like this, you're definitely going to feel your body fighting that rotation, which means those core muscles are going to have to kick in quite a bit harder. Now for the lower half, same thing, start out your tabletop, lock that position in as best you can, and then just move one leg straight back. And sometimes I tell people, imagine if there's a box behind your foot and you're just pushing it straight back into the wall. Sometimes when I see people do this, they lift their leg too high and they kind of arch their back. So again, just try to stay pretty much in that same position as best you can. You're going to extend a little bit through your back, so it's not to say there's not going to be any movement, but you shouldn't really feel like there's a lot of extension happening in your back. You shouldn't really feel like, again, there's a lot of wiggling happening, okay? So that's how you would do the legs. Once you've got that figured out, then all you're going to do is combine an opposite arm and leg together to do what we tend to call a bird dog, okay? And if you notice, when I move my hand, I tend to turn my thumb up toward the ceiling because it just gives a little bit less crowding in the shoulder so that you're not impinging yourself as you're doing this, okay? And so again, good brace through the core and just exchanging opposite arm and leg. Okay, so just a few strategies there on how you might be able to help alleviate some of your back pain. The idea again is just trying to gradually incorporate some movement that you're not able to tolerate right now. So, a lot of times bending and, lifting and twisting your back, when those muscles are really guarded and kind of spasm, many times they won't let you do that. So if you can just kind of gradually start to tolerate a little bit of flexion, gradually a little rotation, those things aren't inherently bad for our back. It's just that when we do them on a repetitive basis, when we do them with, beyond kind of the low tolerance of the tissue, over time, these can definitely sometimes work against us. And so a lot of times you also have to modify the activity. And so, if you're a nurse who's always lifting patients all the time, if you're somebody who's sitting at a desk all day, people that have to basically be, bent over lifting heavy items, all these things can sometimes work against you. And so many times you're going to have to do some exercise to sort of start to tolerate that movement, strengthen those, kind of core trunk muscles or hip muscles again. But then also you've got to look at what you're doing on a repetitive basis. It might be hurting your back. And so even the best exercises in the world aren't always going to help you if you're continuing to do something that's really working against your back. Obviously though, there can also be other serious things that sometimes are going on that can kind of masquerade as simple, straightforward back pain. So definitely if there's any questions, when in doubt, if you're not getting any better, I would definitely encourage you to talk to your doctor, talk to an orthopedist. It certainly could warrant further investigation. But I've had some pretty good results of this stuff and more straightforward cases of back pain. Definitely comment and let me know if you have any questions. Definitely like and subscribe if you like this stuff. And as usual, I certainly hope it can help.